Medical nanotechnology, revolutionizing healthcare. Welcome to the world of medical nanotechnology, a field that merges the realms of medicine and engineering to develop innovative solutions for diagnosing, treating, and preventing diseases. In this script, we will delve into the fascinating domain of medical nanotechnology, exploring its applications in the management of diabetic retinopathy, a leading cause of blindness worldwide. We will explore the pathological process of diabetic retinopathy, the anatomy and physiology of the retina, and how nanotechnology has revolutionized various aspects of ocular healthcare. Additionally, we will examine the potential of nanotechnology in retinal regeneration, biomarker detection, sustained drug release, personalized medicine, oxidative stress management, gene therapy, and stem cell therapies. Let us embark on this enlightening journey through the world of medical nanotechnology. Diabetic retinopathy is a microvascular complication of diabetes that affects the retina, the sensory tissue at the back of the eye. In this paragraph, we will delve into the intricate pathological process underlying this condition. The chronic hyperglycemia in diabetes triggers a cascade of events, including the activation of various biochemical pathways and the release of pro-inflammatory factors. These changes lead to the damage of retinal blood vessels, characterized by endothelial dysfunction, increased vascular permeability, and the formation of microaneurysms. Furthermore, the progressive hypoxia in the retina stimulates the secretion of angiogenic factors, such as vascular endothelial growth factor, VEGF, resulting in the growth of abnormal blood vessels. These vessels are fragile and prone to leakage, leading to retinal edema, hemorrhages, and eventually, vision loss if left untreated. Now that we understand the pathogenesis of diabetic retinopathy, let us explore the potential of nanotechnology in managing this condition. To comprehend the impact of nanotechnology in the field of ocular healthcare, it is crucial to familiarize ourselves with the intricate anatomy and physiology of the retina. The retina is a delicate layer of tissue that lines the inner surface of the eye. Comprised of specialized cells called photoreceptors, it plays a pivotal role in capturing light and converting it into electrical signals that can be interpreted by the brain. These electrical impulses are transmitted by the optic nerve to enable visual perception. In addition to photoreceptors, the retina comprises various other cell types, including ganglion cells, bipolar cells, and horizontal cells, which collaborate to mediate the complex process of vision. Understanding the intricacies of retinal anatomy and physiology allows researchers to design nanotechnological interventions that specifically target the affected components, thereby ensuring more efficient and targeted medical interventions. One of the key advancements in medical nanotechnology is the development of nanoparticles for targeted drug delivery. Conventional drug delivery systems often suffer from limitations such as poor bioavailability, lack of site-specific targeting, and undesirable side effects. Nanoparticles offer a promising solution to overcome these challenges. These tiny particles, typically ranging from 1 to 100 nanometers in size, can be engineered to carry therapeutic agents to specific locations within the body, including the retina. By functionalizing nanoparticles with ligands that specifically recognize receptors on the surface of diseased cells or blood vessels, researchers can achieve precise drug targeting. Additionally, nanoparticles can protect the encapsulated drugs from degradation, prolong their circulation time, and release them in a controlled manner. This targeted drug delivery approach significantly enhances the therapeutic efficacy while minimizing systemic toxicity, thereby revolutionizing the management of diabetic retinopathy and other ocular diseases. Maintenance of glycemic control is crucial in managing diabetes and preventing the progression of diabetic retinopathy. Traditional glucose monitoring methods, such as fingerstick testing, have limitations in terms of invasiveness, inconvenience, and lack of real-time monitoring. Nanotechnology has paved the way for the development of nanosensors that enable continuous glucose monitoring with improved accuracy and reduced patient discomfort. These nanosensors can be integrated into wearable devices or implanted under the skin, constantly measuring glucose levels in interstitial fluids or tears. Some nanosensors even utilize the phenomenon of fluorescence resonance energy transfer, FRET, to generate a fluorescent signal proportional to glucose concentration, allowing for non-invasive glucose monitoring using specialized eyewear. By providing clinicians and patients with real-time glucose data, nanosensors empower individuals to make timely interventions and optimize their glycemic control, reducing the risk of diabetic retinopathy progression. Accurate diagnosis is the foundation for effective disease management. In the realm of ocular healthcare, nanotechnology has revolutionized diagnostic imaging techniques, enabling early detection and precise characterization of ocular pathologies. Nanoparticle-based contrast agents, such as quantum dots, superparamagnetic iron oxide nanoparticles, spions, and gold nanoparticles, have emerged as powerful tools for enhancing imaging modalities like optical coherence tomography, OCT, magnetic resonance imaging, MRI, and computed tomography, CT. These contrast agents can be functionalized to specifically bind to retinal cell receptors, enabling targeted imaging of pathological changes. Moreover, their tunable optical and magnetic properties allow for multimodal imaging approaches, providing complementary information about the retina's structural and functional characteristics. The integration of nanotechnology into diagnostic imaging promises improved sensitivity, specificity, and resolution, thereby facilitating prompt and accurate diagnosis of ocular conditions like diabetic retinopathy. In addition to managing the pathological process of diabetic retinopathy, medical nanotechnology strives towards restoring lost visual function. Nanomaterials, with their unique properties and capabilities, offer exciting prospects for retinal regeneration. Tissue engineering approaches incorporating nanomaterial scaffolds, such as electrospun nanofibers and hydrogels, provide a supportive environment for the growth and differentiation of retinal cells. These scaffolds can be functionalized with growth factors, extracellular matrix components, and other bioactive molecules to enhance cellular proliferation, migration, and integration within the damaged retina. Furthermore, nanoscale drug delivery systems can transport neuroprotective agents and stem cells directly to the retinal tissue, fostering cell survival and promoting neuronal repair. The synergy between nanotechnology and regenerative medicine offers hope for restoring vision in individuals with diabetic retinopathy and other retinal disorders. The identification and quantification of specific biomarkers associated with ocular diseases, including diabetic retinopathy, play a crucial role in early diagnosis and prognosis. Nanotechnology has facilitated the development of nanobiosensors capable of rapid and sensitive detection of these biomarkers. Functionalized nanoparticles can be engineered to selectively bind with biomolecules of interest, generating specific signals that relate to the disease state. For instance, gold nanoparticles functionalized with antibodies can specifically detect elevated levels of VEGF, an important biomarker in diabetic retinopathy. Nanobiosensors offer the advantages of high sensitivity, rapid response times, and real-time monitoring, enabling clinicians to monitor disease progression, evaluate treatment efficacy, and tailor interventions to individual patients. These nanoscale devices hold immense promise for precision medicine in the field of ocular healthcare. The precise control of drug release kinetics is crucial for achieving optimal therapeutic outcomes while minimizing side effects. Polymeric nanocarriers, such as liposomes, polymeric micelles, and dendrimers, have emerged as effective vehicles for the sustained release of drugs within the ocular tissues. The unique physicochemical properties of these nanocarriers allow for the encapsulation and protection of therapeutic agents, preventing their premature degradation or clearance. Furthermore, the release of drugs can be modulated by altering the composition, size, and surface characteristics of the nanocarriers. This control over drug release kinetics enables prolonged therapeutic effects and reduces the frequency of administration, improving patient compliance. Polymeric nanocarriers hold great promise in the management of diabetic retinopathy, where the long-term delivery of anti-VEGF agents or neuroprotective molecules can effectively counteract the disease progression and preserve visual function. Personalized medicine aims to tailor medical interventions to individual patients based on their unique characteristics and needs. In the context of diabetic retinopathy, Nano Theranostics encompass the integration of therapeutic and diagnostic functionalities within a single nanoscale system. Such systems can simultaneously detect disease biomarkers, monitor treatment response, and deliver therapeutic agents in a targeted manner. By utilizing nanotheranostics, clinicians can make informed decisions on treatment strategies, ensuring optimal therapy selection and dose adjustments. The real-time monitoring capabilities of nanotheranostics enable clinicians to assess treatment efficacy promptly, enabling timely adjustments to enhance patient outcomes. The individualized approach offered by nanotheranostics holds great promise in optimizing the management of diabetic retinopathy and improving patient outcomes. Oxidative stress, characterized by an imbalance between the generation of reactive oxygen species, ROS, and the antioxidant defense mechanisms, plays a pivotal role in the pathogenesis of diabetic retinopathy. Nanomaterials, such as antioxidant nanoparticles and nanocarriers loaded with antioxidant agents, offer a novel strategy for targeting oxidative stress in ocular tissues. These nanoscale systems can scavenge ROS, counteracting their damaging effects on retinal cells. Nanoparticles laden with antioxidants, such as curcumin, resveratrol, or quercetin, can be designed to specifically reach the retinal tissue and exert their protective effects. Moreover, the controlled release of antioxidants from nanocarriers ensures sustained therapeutic benefits. By harnessing the potential of nanomaterials to combat oxidative stress, researchers and clinicians can mitigate the progression of diabetic retinopathy and enhance visual outcomes. Gene therapy holds immense potential in revolutionizing the treatment landscape for ocular diseases, including diabetic retinopathy. Nanoparticles offer an efficient and versatile platform for delivering therapeutic genes to retinal cells. These nanoparticles can either carry the therapeutic gene within their structure or utilize their surface properties to facilitate gene transfer. By functionalizing nanoparticles with cell-penetrating peptides or targeting ligands, researchers can ensure the efficient internalization and localization of the therapeutic genes within the desired retinal cells. Furthermore, the controlled release of gene cargoes from nanoparticles allows for sustained expression of the therapeutic proteins, ensuring long-lasting therapeutic effects. Nanoparticle-based gene therapy holds promise as a potent intervention for arresting the progression of diabetic retinopathy, opening new horizons for vision-preserving treatments. Stem cell therapies offer groundbreaking opportunities for tissue regeneration and repair. In the context of diabetic retinopathy, stem cells have the potential to restore damaged retinal tissue and preserve visual function. Nanotechnology plays a critical role in supporting and enhancing the efficacy of stem cell-based therapies. By leveraging nanomaterials, researchers can provide scaffolding structures that mimic the native retinal environment, promoting stem cell attachment, survival, and integration. Additionally, nanoscale drug delivery systems can transport growth factors and other bioactive molecules, creating a conducive microenvironment for stem cell differentiation into functional retinal cells. The integration of nanotechnology with stem cell therapies holds immense promise in the management of diabetic retinopathy, potentially offering a regenerative approach to combat the progression of this devastating ocular disease. In conclusion, medical nanotechnology offers significant advancements in ocular healthcare. With targeted drug delivery, glucose monitoring, imaging techniques, regenerative medicine, biomarker detection, sustained drug release, personalized medicine, oxidative stress management, gene therapy, and stem cell therapies, nanotechnology shows promise in managing diabetic retinopathy and other ocular disorders. By precisely targeting pathology, enabling early diagnosis, promoting regeneration, and tailoring treatments, nanotechnology provides personalized and effective interventions. As researchers and clinicians advance innovation, the future of medical nanotechnology shines brightly, offering a world where blindness becomes rare rather than a sobering reality.